The advice and opinions expressed by Dr. Granpeesheh and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Granpeesheh is
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Good morning and welcome to Ask Dr. Doreen. I'm Shannon Penrod and look who I'm here with.
Good morning, Shannon.
The fabulous Dr. Doreen Granpeesheh. So thrilled to have you here this morning.
Thank you very much. Good morning.
You look fabulous.
Well, I don't know about that.
You do.
It's been a morning already, but thank you.
Don't you love it when 10 o'clock in the morning feels like 10 o'clock at night? Like you've already earned all the Girl Scout badges
You just
for the
got to
day.
go back to bed. It didn't start right today.
Right. Some days like do-over. But no, we're here. We're live. It is the 2nd of September, 2025. I was going to say 2020 million. 2025. We're live in the studio. Boy, have we got a show for you today. But want to take just a second and remind all of you that when we're live on Facebook, YouTube, Twitter, and about a dozen other sites. Our brilliant Chris Desmond is going to put a bunch of stuff on the screen if you're watching us on any of those formats to see all the different ways that you can access the show. I want to take a second to remind you that we do have a really robust YouTube channel, Ask Dr. Doreen on YouTube. You really need to check it out. There is over a decade worth of content. I think literally next week is when we start. I always get confused. Are we starting the 14th year or are we ending the 14th year?
I think we're ending now.
So we're starting the 15th year.
Yeah.
It's crazy, you guys. Absolutely crazy that we've been doing these shows for this long. But a robust YouTube channel, Ask Dr. Doreen, that's separate from the Autism Live YouTube channel. But we know that most of you are listening to us in podcasts, and we appreciate that so much. Check out the Ask Dr. Doreen podcast if you haven't already. I want you to know that if you download the free download, I guess that's redundant, it is a free download on any of the places that you get it. But if that is cumbersome to you because you're on the treadmill and you don't want to listen to ads, you're in the car and you don't want to listen to ads, please go to glow.fm/autismlive. When you go, it's $5 a month, which is amazing. And you get everything that we do at the Autism Network, including Ask Dr. Doreen and Autism Live, and you get it for $5 a month in your inbox, no ads. So check that out if you so desire. Briefly want to mention that it is, now that it's September.
I know,
I love when it's September. I do. I love this time of year. I know it all gets a little busy, but I love it. But it is officially, the tickets have gone on sale for All Ghouls Gala.
Okay.
So, and they're moving fast, and I really believe that it's going to sell out this year. So, and it's going to sell out early. So if you want tickets, they are, very inexpensive. Very inexpensive because it's a fully inclusive evening, open bar,
drinks and
food,
amazing food,
and
music,
so many opportunities to do so many things. So, please, I think we've got something on our social media. Of course, I can't think what the website is. I'm a total failure right now. If Chris knows, he'll put it up. But before the end of the show,
it is on October 25th.
Yes.
And in the Woodland Hills area of Los Angeles.
And it is, I think, the Hollywood Halloween party. Everybody has said to us that it's, it's just the best thing. But the main thing that you guys need to know is that it all raises money for autism care today.
Right.
So that's really the thing. And even if you aren't able to be here, which you should find a way to be here.
And this is our 5th year, I believe?
I think this is the 4th. It's the 4th annual.
I don't know. I think it might be the 5th.
Chris is showing me 4 fingers.
Oh, okay.
But I know it feels like it's been 5, doesn't it?
Yeah, it does.
But in any case, really good time. We'll make sure that we get the website before the end of the show. Okay, today, this show, I promise you that we're going to be talking about some things that hopefully will elucidate for some people.
Right.
I want to make sure that there's a fair amount of misconception around what we're going to talk about.
Right.
So if you're going to watch the show, I'm going to ask you to watch the whole show. if you find yourself being like, no, I want you to listen and give yourself a moment to appreciate what this show is about.
Right.
Because we're going to be talking about recovery.
Right.
And this is sometimes this is, for some people, this is hard to listen to.
Right.
For various and sundry reasons that we can go into.
Right.
But it's a very real thing.
Right.
And that's one of the things that I really want to elucidate here, is that it is a real thing. And maybe we should start with a definition of what recovery, when we're talking about autism, what does that mean when you're talking about it?
Yeah, and thank you for that, Shannon. And we've had a lot of people over the years kind of talk about this issue, ask us questions about this issue. So we've intended to do this show and actually attack this topic. So I'm glad we're getting a chance to do it now. So, I am first and foremost, obviously, a clinician, and from a clinical perspective, especially when it comes to issues or disorders that are in the Diagnostic and Statistical Manual of Mental Disorders, the DSM, which is this really thick book that we use to identify various issues and disorders. And why do we use this book? Why do we call it anything? Let's put it that way. There's a lot of benefit to labeling disorders. One benefit is that it allows people to find themselves amongst a group that is similar, and that's a very cathartic experience. It's like, oh my God, I'm not the only one in the world. There are many others like me, and they all struggle with the same stuff. The second one, which I think is even more important, is to be able to access care, treatment. If you go to a doctor every single time and you have no idea what's wrong with you, they will have to, or if there's no name to give it, they'll have to ask you 1 million questions and also do 1 million tests in order to identify what is going on and then to be able to possibly help you, right? So when you have a name for something, it helps a lot because others who have had that something have done certain things, right? They've received certain treatments, and those treatments have predominantly, hopefully, been successful for the majority of them, and therefore, that's going to be the first treatment that's recommended to you. ABA is a good example. If you didn't have the label autism or autism spectrum disorder, ASD, and you went to a doctor and you described your child's symptoms, I'm not sure that you'd even know exactly which symptoms to describe, because there are so many that come together to form this label, right? And that would be a tremendous burden on your time, and the doctor would have to be very, very smart to figure out, oh, they're describing one form of the spectrum to me, autism. And then, though, once the label is there, the doctor is able to say, oh, okay, well, the most successful treatment for this is ABA. It has been so. I recommend you do some ABA. So that's how treatment works, right? They're very, very connected to labels. And those labels are very important. Obviously, another reason the label is important is that payers, insurance companies, depend on those labels in order to provide the right amount of money for treatment. Now, when those labels, especially in when we're looking at mental issues, mental disorders, but I think also in some physical disorders as well, but when you're looking at those mental disorders, those labels are defined by symptoms, right? Behavioral symptoms very often. Sometimes there are physiological things that also accompany those behavioral symptoms, but a lot of times they're just, symptoms, and I'll explain in a second. Let's talk about depression, right? Major depressive disorder. Depression is defined by having melancholy and sadness and hopelessness and having this really depressed, all these feelings of depression for a period of time without anything helping you. Anxiety is defined by having these symptoms of, not being able to breathe or rapid heart rate or all this sort of stuff. Anxiety is like worry, being scared of things. It can depend, these are all descriptive symptoms, right? And then you get a diagnosis of, let's say, specific anxiety or generalized anxiety or major depressive disorder or whatever it is, but it's based on symptoms that you have and describe. Okay, so autism or ASD. ASD is also defined by symptoms, by a series of symptoms. And in the last DSM modification, which was back in 2013, we changed it slightly, but still, autism requires two different types of symptoms. One type is in the area of social communication, and these are symptoms like the individual has a difficult time in social situations. The individual cannot communicate as others in that age range would. The individual has nonverbal social issues like eye contact is difficult for them. All these different symptoms are listed, right? And if you have enough of the symptoms, then you meet the criteria for the first part, the domain 1. There's 2 domains. So the second part has to do with these repetitive, ritualistic, stereotypical behaviors, like, on the one hand, things like hand flapping, body rocking, looking at things, gazing at them from the corner of our eyes, putting things in an order, doing things repetitively, opening and closing the door. These are all called what we call self-stimulatory behaviors, right? That is one section of one of the symptom domains. Other things under that domain, stereotypic, repetitive behaviors. So think of those things. For instance, other things could be, different types of reactions to sensory stimuli. So there are some social communication issues, and there are some repetitive, stereotypical sensory issues on the two sides. And if you have enough in here and enough in here, you bring them together. Oh, this individual has enough symptoms to actually receive a diagnosis of autism. Yeah. Okay. Now, all the tests that are done in the world are just done in order to not be subjective about those things. So in other words, either the child does have a language delay that is more significant than their peers would, or they don't. So we test it. Either the child does have social responsiveness issues, or they don't, in contrast to their peers. So you don't have to test those things, but you can test those things, and you just want to be very clear that you have the 3 in this domain and the 2 in this domain, and they add up, and now, okay, this individual has a diagnosis of autism spectrum disorder. Okay. Now, you also have to give some other clarifying comments, let's say, on the diagnosis. So one of those clarifying comments is what we call the severity levels. So in each domain, is this individual a 1, 2, or a 3? 1 means they're mildly affected and don't need as much support. 3 means they're very affected and they need a lot of support in that area. And again, a 1, 2, or 3 in the other domain. So 1 is, this individual doesn't really struggle with sensory issues or medical issues. Or 3 is, wow, this person really gets thrown off when they go into a room with, this kind of lighting, or whatever it is. So those are subjective ratings of the clinician in order to be able to, subdivide this very, very wide spectrum. So we have diagnosis of ASD, and there's some other factors as well. For instance, you want to name if there's catatonia present, you want to name if there's language disorder present, etc. But overall, you've diagnosed the individual and you have severity levels. Okay, now this individual goes and receives treatment, whatever treatment it might be. It might be behavioral, it might be medical, it might be, whatever it might be. And 3 or 4 years later, they come back and they don't have those symptoms anymore. They might have 1 here, for instance. They might still have sensory sensitivity to various things on their skin, But they've gotten to the point where they can handle it now, right? So they just give themselves a little bit of preparation in the morning, and now they can wear long sleeves, and it's not a problem. On the language stuff, they've learned a lot of language over the years, and they've really, really practiced social interaction, and now they're able to fit within the norm. So other people can't really recognize that at some point this individual couldn't really talk to others. At some point this individual would aggress if they were frustrated. At some point this, that, and the other, right? And we no longer see any of those things. Maybe we see something as little as, okay, they go into a room like this and the lights are gonna bother them. But hey, that's not a big deal. That's not gonna take away from their life. And it's just one. It doesn't pass the threshold that is required for the diagnosis. So as a clinician, your job is to remove that diagnosis. This individual no longer qualifies for the diagnosis of ASD based on symptom criteria, period. That is the end of that. Okay. Now, back in the, 70s, 80s, and so on, when we started to really work very, very hard with people on the spectrum, we realized that some people, and it's a combination of reasons why, but some people would actually get to a point where they could lose the diagnosis because they no longer there's no way a clinician would be able to ever diagnose them. So this was, of course, 1987, very, very famous study that changed the entire world of autism treatment, and also just the way we look at autism, right? And this was the study at UCLA by Lovas, and I was there and one of his students and part of this study, and what we did was we had 3 groups of children. One group was our kids, and there were, I believe, 10 kids in that group. And what we did is we worked with them very, very, very intensively, teaching them as intensively as we could. Like that means we trained their parents. We heavily had students from UCLA who would go to their homes. That's how I started actually in the field. I was one of the therapists who would go to the homes, and you would work and teach the child everything they needed. And then the second group was another group that was matched in age and functioning level, but they were at a different part of UCLA, which was more a psychiatric center, Neuropsychiatric Institute, and there they did a different type of treatment. And then the third group were kids who lived too far from UCLA for us to be able to treat, so they were our control group. And so, but all of them were matched when we started, so they all had similar language levels, similar eye contact, similar lots of different things, right? And so we worked with them for about 2.5, 3 years, and after that, we came back and we saw, wow, a lot of the children in the experimental group, in the first group, who were receiving, we called it all waking hours, so it was 40 hours of us, students, plus whatever the parents could add to it, of one-to-one teaching. Half of those children didn't fit the symptom criteria anymore. They came back, and it wasn't just us deciding that, it was actually another outside psychiatrists looking at these kids and saying, they don't fit the autism diagnosis, unknowing what their prior diagnosis was, right? So blank slate. So half of those kids, so actually 9 out of 19, I believe, were no longer meeting the criteria, right? And so that was a very, very important thing. And when we started writing, whereas in the other 2 groups, it was 2%. So this group was 47%, which is basically almost half, and the other group was 2%, right? So it was, I think it was 1 individual out of 19. So basically the bottom line was, wow, it is possible to do a certain number of things and for the individual to actually lose the diagnosis of autism. So then everyone really, really focused on what are those things that you can do to eliminate this diagnosis. And that was the beginning of ABA. And it was called behavior modification, and then over time it became applied behavior analysis, and the whole field grew tremendously, as you know. It's been fun to watch. So, okay, now we have this incredible field. And what was it doing in the beginning? Oh, right. It was getting rid of all these symptoms that are diagnosed as autism. It was recovering kids. What does recovery mean in clinical terms? What it means is the loss of symptoms so that you no longer qualify for any disorder that you were previously diagnosed with, whether that's depression, anxiety, PTSD, OCD, autism, you name it, it's always the same. You either have enough symptoms or you don't. If you don't, I could say, in clinical terms, we don't use the term remediated because that's very different. That's a different thing. But I could say loss of symptoms, but it is very clearly referred to as the individual has recovered from this disorder. Okay, so let's apply that to, let's say, PTSD. Let's say someone has post-traumatic stress disorder, right? If they were to not do anything about it, they would have a very difficult time because that would kind of overshadow their lives. Same as autism. If they were to now go and get a bunch of treatments for it, maybe just cognitive behavioral, maybe medical, it doesn't matter. If they get a bunch of treatments for it and they come back, they have now recovered from PTSD. Doesn't mean that, like, for instance, they might still go into a location and feel uncomfortable, but it isn't a severe enough symptom to be classified as a diagnostic symptom of PTSD. Same thing with anxiety. Let's say you have anxiety, the severity and the length, duration, and all of that has to be so significant that it's diagnosable as, let's say, generalized anxiety, okay? Now, if you go and get treatment for it and you come back, you might still get a little bit uncomfortable in certain situations, but it's not going to be any different from the rest of us. And it's going to, most importantly, it is going to allow you to live a healthy, happy life. And that is, these things that I'm saying, Shannon, are all connected in clinical terms. It's like these symptoms exist, they make your life harder, and to the, not just harder, but to the point where you feel it's a disability, you are disabled because of these symptoms. We work on them. The majority of them are alleviated or just gone, and you can live a life where you don't feel disabled. It's really that simple. It's that. And so for us, for a very long time, we were very proud of being able to say, so-and-so was recovered from autism. Okay. Now, and we published studies on this, and I made a videotape showing that it's possible. And why did we do all that? We did all that because we wanted to give people a hope, first of all, parents especially, because when you first receive the diagnosis, you know that, and often, we have this conversation often with our friend Bryce, and she's like so angry because the doctors make a point of trying to take away your hope.
Yeah.
You know, like so many parents would come and tell me, the doctor said, take him home and make him comfortable. He's never going to be okay. You know, save your money because you're going to need it the rest of it. This is such a terrible thing to just really think it's your job to remove all hope, you know? So a lot of times that would happen. And so for us, it was like, no, parents of kids who've done extremely well, who have recovered, whose symptoms no longer classify as autism, go out there and talk to the world about it. Let's publish on this. Let's make a video. Let's do everything we can, because we don't want the next parent to give up. We don't want the next parent to think it's not possible. Now, why is that important? Okay, because now I've come back after like 5 or 6 years of being out of the field, and I gotta tell you, it has gone away. There's very, very few people, in contrast to 2018, I would say, or even 2015, who would believe that it is possible to lose the vast majority of the symptoms of autism in such a way that you can lose the diagnosis. People don't believe that anymore. And if they did believe that, I would see a lot more hard work being put into it. And it's just not happening, Shannon. And I say that not just from the parents' perspective, I see parents who will come in and will cancel sessions all the time because they think, oh, what's the big deal? I'm going to cancel 2 hours here, 4 hours there. It's like speech. He'll get some more next week. Whereas I promise you this, I can talk about this forever. No parent back in the 80s, 90s, even early 2000s would ever cancel a session. This was the most important thing in their child's life. Parents treated ABA like chemotherapy. Let me tell you, they would not skip a single session. And they would get upset at us if we were providing, 20 instead of 21 hours. Like, they were very, very adamant about getting all their hours because they believed in the value of it, right? And not just parents, also people coming out of school right now. A lot of BCBAs and clinicians don't believe that it is possible. And over time, why has this happened even actually over time? And this is the terrible thing that came about with public funding. I was like so excited when we got health insurance to cover ABA. But what happens when you get health insurance to cover something is that they put massive resources into reducing the amount that they cover. I mean, this is true of everything, right? Like right now, it's really hilarious to me. I have high cholesterol, right? And it's genetic, because you know me, I have a pretty healthy lifestyle.
You eat very clean.
Yeah, and I've tested, and they know it's genetic. Okay, so it's genetic. With genetic people, you can't do anything. So my doctor recommended these medications. And I also have a lot of back issues, so I cannot take statins because they kill my back. Okay, so doctor's like, no, there's a bunch of other choices you can have. Let's just ask your insurance to cover this one injection. Yeah. Okay, they deny it. Well, this is a really important issue. It's cholesterol. Like, this is very vital. So my doctor says, you know what? It's okay. I've tried to fight with them. They won't allow it. Let's get you a heart CAT scan and make sure there's even plaque in your heart. If there isn't, we don't have to worry about it. Okay. So I go and I do this ridiculously complicated procedure. They, test my heart to see if there's plaque. They speed it up, slow it down. Horrible procedure. Lo and behold, there is plaque. So we must put this medication in place. Guess what? They deny it again. Wow. So we did all this and they denied it again. Now I talk to my doctor and he's like, well, we're gonna try a different medication. I mean, this is what payers do, right? So even something that is as clear as a CAT scan, they will deny. So when it comes to something like ABA, over the years, an ABA's dosage is hours, right? The more hours you do, the more the child learns. We've published so many times on this. So payers reduced it, they pushed back. Everybody thought, what's the big difference between 40 and 35? What's the big difference between 35 and 25? Let's just do 20. Meanwhile, parents are canceling. BTs, behavior techs, are canceling because nobody thinks this is life-saving, life-changing. This is the most important thing we could be doing for this child now in their life, because the window of opportunity will close. And we must now give this child as much as we can, right? None of that happens. And so what happens as a result? Obviously, the kids don't recover as much because they're not receiving the intervention they're supposed to receive. They're not losing the symptoms that they're supposed to lose. So then everybody looks back and says, yeah, I guess ABA is okay, but it's not really like recovering kids. And so recovery, which used to be our North Star, right, has now become shunned. It's like, why do you talk about recovery? These kids don't recover. So that's one thing that happens. And then, of course, the other side of it is, remember I said there's people who are very severely affected, who are 3-3 severity, people who are very mildly affected, 1-1 severity. And those folks who are 1-1 severity actually have a voice because they are minimally affected by autism. They actually could live a pretty functional life. They need supports. They need some supports. They need therapy. Maybe they have anxiety around certain situations, etc. Meanwhile, those individuals who are 3-3, they can't live on their own. They can't live without tons and tons and tons of intervention and support. They don't have a voice. Nobody's speaking for them. So the individuals who are 1-1 find it offensive that we are trying to recover them and the other people who are more severely affected. And they say, why do we need recovery? We can live perfectly fine the way we are. And that may be true, but the truth is, if you as an individual can live perfectly fine the way you are, you should never have received a diagnosis to begin with. Because a part of every mental diagnosis is it must be severe enough to significantly detract from your social life, your work life, your home life. If it doesn't, if you're perfectly fine, you don't need help. In fact, you don't even have a diagnosis. You're fine. You may have all the symptoms, but their severity is not sufficient for you to get a diagnosis. So, great, please keep living your life, that's wonderful. But somehow, in my opinion, we really do need to take away this dark cloud that is on the term recovery. There is absolutely nothing wrong with that term. It means you've lost the symptoms you used to have. You know, so that was my 30-minute rant on the subject. Do you know I'm passionate about this stuff?
I know you're passionate about this. You've devoted your life to it.
Yeah.
I want to throw a couple of more logs on the fire and hear your thoughts on it. Having been in this community now for 20 years.
Yes.
And being a parent in this community, which is vastly different than being a person on the spectrum. But I talk to my son every single day, and he has a lot to say.
Great.
And I talk to a lot of my friends who have a lot of things to say. And what I keep hearing is the word identity and the difference between how we all view autism. That there are a lot of folks that are on the spectrum that are probably more in the 1-1 category who have big thoughts about their autism. And they view it as their identity.
Okay.
That it is their identity. And so when you talk about recovering it to them, that means you change the way my brain works. And
which is true, actually.
And that's part of their identity. Well, I think the finer point for me is when we talk about...
But let me ask you a question,
Yes.
and these are the things I wish I had a chance to actually talk to more individuals about
I'll
this
line 'em
straight
up
on.
for you.
That would be awesome. That would be awesome. We do change the way your mind thinks.
Yes.
Like, what do you think happens when someone has major depression?
Well, a lot of that is inner thought.
Which is
Completely.
based on someone teaching them how to change their thoughts.
Yes.
How we survive life by learning to change our thoughts.
And part of that is teaching. I think the finer point, and we actually had a question, and I'm going to get to that because this was a question that was asked of me and said, I want to know from Dr. Granpeesheh, because I feel like there's a difference between autism, because I've come to look at the way my son's brain works. Even now, my son's brain works differently than mine. It's so much more elegant. You've talked about this endlessly.
Absolutely,
The things that the client that you had that could walk into the room and immediately tell you how many ceiling tiles there were.
Right.
Like this elegance that there is from a brain that has shaped, formed differently.
Yes.
I think people are calling it neurodiverse, neurodivergent now,
Right.
Instead of sticking to the autism, although it feeds in all these other things. But the point is, they don't want to lose that.
Right.
That's their identity.
Fantastic.
And they don't want that taken away from them. And so I have started saying that, it's removing the disabling aspects of autism.
Of that.
You can have
Exactly.
the brilliant brain, but if you can't convey your thoughts, you're trapped.
Yes, and that's a great way to put it. But also, it is toning down the brilliant part. And I want to talk about that for a second.
That's a bummer, though.
No, it's not a bummer.
Okay.
It's only a bummer if you don't want to live in society. If you choose to live an isolated life, then absolutely, that's Einstein, that's Heidel. There's a lot of people that I could name, right, who live outside of society. And even with Einstein, for instance, and he had these incredible brilliance, and we believe he had autism.
Yeah.
And if you think about that, if I walk into a room and I have the ability to count all the tiles, and I know, it's funny because I had the experience with this one child, that was all he could do. This is what he would count, then he would count those, and then he would count all the lines on those, and then he would count these, and then he would count all the objects, then he would start counting the lines on your t-shirt, and it would get to a point where it did not matter what else was going on. Now, if that's how he chooses to live and his parents choose to live, yeah, he doesn't need intervention. But if he wants to go to school, if he wants to be safe crossing the street, if he wants to know that it's not a good time to count when there's a fire, if he wants to have a conversation with a girl in the future, all of those things require him to be able to stop counting when it's necessary.
As a choice that he makes.
As a choice that he makes.
Yes.
But it's something that you have to learn to be able to choose.
Absolutely.
And I'll contrast this to ADHD individuals. That's a disorder too, right? Attention deficit hyperactivity. Why is it a disorder? Because of how difficult, there's so many reasons ADHD makes life so much harder. But think of the individual with ADHD who's never been medicated, who has lived most of their lives with this, right? What has happened to them over the course of time? They probably really, really, really struggled to get decent grades, right? Because they can't attend. They usually get up and leave the room in the middle of conversations, which basically means they're missing a lot of conversation that's going on, so therefore they would be more isolated. They lose their things because they don't remember where they put them, which means that's very depressing to lose things that might be of value. Think of all the symptoms and how that affects your life, right? So what happens with that individual? We give them medication, we teach them awareness, how to be present. And yes, they can choose to practice those things or not, right?
Well, that's a huge point though, because I think what a lot of people misconstrue is that ABA is going to force you into being like everyone else, like a cookie cutter normal. But I like to think of teaching as giving you more choices. And so, for instance, Temple Grandin was taught, and her mother said to her, you can spin the plate on your bed for 1 hour a day, but then you have to go and do other things. She still chooses to do things that fulfill her sensory.
We all do.
While she's doing her other things, but she has the choice to do that because of the way that her mother taught her.
And everybody's like that. I
Well,
want to say
they have the opportunity to be like that.
Well, so let me just say, you said, we're going to teach you things that are, I guess, that's a great example, but what were the words you just
used?
What
parents say is, are you going to, or what advocates say, are you going to force me? Force me to be like everyone else.
Okay, great. Great. Because it's not a matter of forcing you, it's a matter of teaching you to be like everyone else. I don't want to get around that because it is the truth. So society is this thing, and it is defined by certain criteria, right? It's like, we don't go into society undressed. There's an example, right? Everybody has to get dressed if you're going into society. Now, let's say there's an individual with autism who has really significant skin issues, sensitivities, and they're like, there's no way on earth I'm going to get dressed. So what's going to happen with that individual? They're just not going to be allowed in society because realistically, you can't go to a supermarket naked. People are, you know what I mean? You're going to get arrested. So bottom line, there are certain things that society forces us to learn. And it is a change in behavior. It is a change of the identity. It is a change. That individual, in fact, might feel more uncomfortable having cloth on their skin, but if they want to go to the supermarket, it's the only way they're going to go. So they have to learn the rules of society. This is what I always say. That's a drastic example, right?
Yeah.
So let's go with a less drastic example. I am pretty high functioning and I really want a girlfriend. I really want a girlfriend.
Yeah.
What are the rules?
Yeah.
Can I go and stand outside her apartment every night staring across with binoculars? Is that okay by society's rules or not? Should someone teach me
Yeah.
what's okay and what's not okay, right? And then when I learn, obviously it's a choice.
Right.
If I keep doing that, I'm never gonna get a girlfriend and I might even get arrested.
Right.
If I do stop doing that and learn other ways to communicate and I choose those,
Yeah.
I'm possibly gonna have a relationship.
Yeah.
So all of us, this is what I keep trying to say, we all have identities. I have an identity of being an Iranian, as well as, you know, being an American, as well as being a psychologist, as well as being a CEO. Like these are the things we do in life form our identity, our background is part of our identity, all of that. But we also tend to select parts of those identities that we don't really feel are appropriate to this life anymore. So for example, maybe I should be covering myself because a lot of people in Iran do.
Yeah.
Maybe I should take my shoes off at the door because a lot of people do. It's you select and you mold over time. That doesn't mean you lose your identity.
Yeah.
You know what I mean?
And I
That's
think
the part
that's
I'll
the point.
keep arguing. Yeah.
I think that is the point, is that I think if people, all of my friends that might be watching, and by the way, I wanted to say hi to Michelle and I wanted to say hi to Joanne. And Rodney's watching too. So thrilled that you guys are all watching us live. I think, you know, for my son and for my friends that are on the spectrum who are worried about identity, I'm always saying, but, you know, if I learn a new skill, it doesn't, of course it changes me, because then I have a new skill to add to my life. But my identity doesn't change. The core of me doesn't change. And I think that's what they want to hear, is that you believe in the sanctity of the identity of the person, and that doesn't go away with recovery.
100%.
I don't feel like my son is any different for the treatment that he had than who. I mean, that's not true. He is different because he can do so many other things. But in the core, I think what they're talking about, the core identity, you know, he is a 22-year-old adult now who makes all of his choices for himself. No one's asking him or forcing him to be anything other than who he is.
Right.
But I can remember the time that he laid in the hallway of a friend's house and said, what do I need to do to get the other kids to play with me?
Yeah. Or
The sheer
even
frustration of that.
And that's a very, very big sentence from someone.
Oh.
And lots of kids.
Oh, there was a time that just would have been a tantrum.
There you go. Or so, you know, like you look at just, let's say, a basic symptom of eye contact, right? If I teach you that in social relationships you need to have appropriate eye contact and give you the amounts and the people and where you look and all that sort of stuff, because no matter how accepting the universe is of minimal eye contact, every time there's an individual in the room who doesn't give eye contact, when they leave, everybody says, what was up with that guy not giving us eye contact, right? Doesn't matter how open-minded people are. Eye contact is expected because it is something that connects human beings.
Yeah.
And it's a symptom of autism, not providing eye contact. Now, you may choose as an autistic to say, no, it's part of my identity. I'm not even gonna try.
Yeah.
Okay.
And that's fine.
Fair enough.
Yeah.
But people will not be comfortable around you because they have a right too.
Yeah.
And that's all I'm trying to say. What I'm trying to say is it is a choice. It's
Yeah.
totally a choice. But it's a choice of fitting in or not fitting in.
Yeah.
And even I go way further than that. It's a choice of surviving and not in some cases.
Yeah.
Right? So like you talk about our dear friend, for instance, whose son would not leave because he was terrified of the fire.
Oh.
Right? Had that individual been taught what to do in an emergency situation, his life would have been saved, and so would his mom's.
Yeah.
That's what I'm talking about. And you can't, when I look at, you know, we were talking about this last week, which is just a beautiful and delightful thing. I started listing all of my recovered individuals, right? And to me, recovered doesn't mean they are symptom free.
Right.
What it means is that they no longer have the diagnosis of autism. Nobody would give them a diagnosis today, your son as well. And whether they like that word or not, from a clinical perspective, you are recovered from autism.
Yeah.
You no longer meet the criteria for this.
Yeah.
You know what I mean? And there's a joy to be had in that. It's the wrong perspective, in my opinion, with all respect, to just think, I don't want to give this up. This is part of my name. Like, it's a part of who I am. It's like all foreigners saying, I never want to give up my citizenship and become an American citizen. It's, you can gain this, and don't worry, you don't have to have that label.
Yeah.
You are still who you are. Remember, who you are produced this label. It's the label you're losing, not who you are.
Well, it is the thing I like about neurodiversity, is that people are turning towards
Everybody's
that.
different.
And so that's how people are identifying
Right.
instead of autism. Because I don't want to leave out the fact that my son's brain does work differently than mine.
But
and if I had the choice, I would pick the way his brain works.
Okay, but do you
But-
think your brain works different than mine?
Yeah, oh, well, yes.
So do you
because
think
you're
we're
brilliant.
also neurodiverse?
Well, that's, boy, I mean,
I think neurodiversity is every single human being. We do not function the same. I don't even function the same with my kids.
yeah, of course not.
But everyone has different brain functioning.
Yeah.
Everyone does.
Yes.
And some are, I mean, that's all I have to say. Like,
Right,
everybody does.
but I don't want to leave out the fact that my son's brain is a particularly elegant, and I think that for the people that I know in the community that identify as neurodivergent, they would say, yes, that's a part of our subset. And I don't want to leave out that removing all the disabling aspects of it makes it that much more elegant. When I look at my friends who have kids who are so severe that every day is such a challenge.
Yeah.
And you know that they don't, you know, as we were talking about our friend who her son, who was a gentle giant, would not leave the house
Yep.
while it was on fire, and so she sat on the stairs and they perished together with her
Yep.
arms around each
Yep.
other, which is beautiful but tragic.
Extremely
Because
tragic.
it could have been prevented. And of course, there's a whole thing now in their name. It's coming up. It's like September 23rd. There's a whole big push of practicing leaving your home, getting help for your child to know what to do in a fire so that never happens again. She was
Right.
a wonderful advocate
Right.
and mom, but that had not happened for
Right.
her.
Right.
But I don't want to take away from the fact that I think the big stumbling block is that people associate it with eugenics, like you're trying to get rid of them.
Yeah.
Nobody's trying
Yeah.
to get rid of them. We're trying to teach you so that you can have choices.
Right.
But I know a lot of people who function in society and go home and do whatever they want to do, and they're not all on the spectrum.
Well, you either are or you're not. That's the other point. It's like, if I say, I don't want to really get rid of depression,
Right.
let's just keep it for a while.
Right.
Like, let's keep depression around.
Yeah.
Let's keep really severely depressed people.
Yeah. Yeah.
That's what I'm saying. The problem is, I think, and I'll cut right to the chase, I think that people just don't want to consider autism, ASD, a mental disorder.
Yeah. Well, that's the truth.
Yeah, and it is.
Yeah.
That's not the Bible. It might not be in 5 years. Maybe it'll be out in 5 years, right? Homosexuality used to be in the DSM.
Yeah.
So I'm as open-minded as anyone on this subject.
Yeah.
But until it is removed or subdivided and parts of it removed,
Yeah.
it is a disorder. And when it's a disorder, by definition, that means it is reducing the quality of life for the individual.
Yeah.
So if it's not, why would you go get a diagnosis to begin with?
Yeah. Interesting point. I want to acknowledge that the Pettit fam said been lurking but listening. And I
Okay.
appreciate that because I feel like there's a lot of people who just hear the word and their brain and maybe their sphincter goes like that.
Oh, Shannon,
Like, and-
there's so much negativity around this terminology of recovery, where it's like it is referred to as like a claim, a untrue claim, all that sort of stuff, And I would say I feel even more comfortable. Like honestly, it's not really about losing the term autism, but I feel like people can maintain their identity and say, hey, I'm a, how you say, like in the DSM, there's addiction, right? There's lots of different types of addiction. And people, when they've gone through, and if they haven't had a drink for 10 years, they still call themselves, I'm a recovering addict.
Yeah.
Recovering.
Yes.
Right?
In the process.
In the process.
Yeah.
And I think it's not a negative thing. Like I just don't see it as a negative thing.
Yeah.
And I'm sorry that anyone would, because it's a really positive thing.
Yeah.
It's like whatever your choices you have made from all the things that you learned have led you to no longer qualify for this mental disorder.
Right.
You no longer need services or help.
Right.
You're not struggling.
Right. And that is the point. That's why I always refer to it as removing the disabling aspects.
Yeah.
For me, when my son was first diagnosed, people called it autistic.
Yes.
Then I saw on Oprah, I saw Holly and Jenny, and Holly referred to it as having autism. And I thought, well, that sounds better to me.
Right.
Then we started treatment at CARD,
Yeah.
and I believed
Yeah.
very much in the concept of recovery. I had every
Right.
reason to believe in the concept of recovery. And we started to say that our son is actively recovering from autism.
Right.
In fact, somewhere on the website, Autism Live, it still says that in my bio or something.
Right.
And then after years, I have to say, I succumbed to peer pressure, and I said, I will stop using the word recovery, but I will never stop talking about the concept of it.
So does it feel better to say no longer qualifies for the diagnosis of autism?
And I have said that
But
before.
does that feel better?
Yeah, it does.
And does that feel better to the individual themselves?
Well, when he
Ask for me.
well, Jem gave me the words he wants me to say.
Okay.
He said, because I said, how do I describe, do I say, whatever? And he said, I say it all the time on the show, I'm a pony, a parent of a neurodiverse individual.
Right.
And
I get that.
He leaves the word out. He says people have all the wrong misconceptions about the A word.
Okay. But that is one day we'll have a huge discussion, which I'll enjoy so much.
Yeah.
But that's a different issue. That's an issue of diagnostics and labeling, which was the first part of my thing here. But I just want to know which one feels better.
Interesting.
Does it
I will ask
feel
him.
better to just call it neurodivergent? Why does that feel better than autistic?
Well, I'll ask him. I
Yeah.
don't want to presume.
Yeah.
But it's a hot topic.
Oh, I know. And we should have many more shows about this
We
topic.
absolutely should. And one of the things that we say on Autism Live is, whenever we're having a guest, I always say to them before they come on the show, I'm going to let you define what your relationship is to autism, because I feel that it's important. You should get to use whatever words you want to use.
Right.
People correct me all the time when I refer to Jem and me as a neurodiverse.
Right.
That I'm the parent of a neurodiverse individual. I've even had Dr. Stephen Shore said to me, technically that's wrong. It's neurodivergent. That's the proper word. And I've said, yes, but he means it in a different way. And it's the word he chose.
Yes, absolutely.
So I'm not taking issue with it. And
Absolutely.
it's interesting that you're telling me that it's wrong.
Well, and trying to just tie it back to the beginning of this kind of conversation we're having, I think if we take away from us, clinicians and the world, the goal that is called recovery, if we take that away,
Yeah.
the value of ABA will continue to go down.
Which
And
is
that's
so
a big,
sad.
this is a big part of what I was trying to get at,
Yeah.
is that we had a goal, Shannon. We used to have a goal.
Yeah.
It was the loss of all symptoms, or the loss of at least enough symptoms that this individual would no longer qualify for autism, would
Yeah.
be recovered. If individuals come now and say, we don't want to be recovered,
Yeah.
then the goal becomes, what's the goal now? The goal is
Right.
going to be, oh, I guess I could maybe just then teach him to say hello. The rest of the social stuff doesn't matter. Like,
Yeah.
it has a very direct impact on the future of therapy. That's a big part of it,
Yeah.
is that, well, if the individual doesn't want this stuff, what are we actually teaching?
Yeah.
And then remember, parents will come in and say, listen, I just want him not to tantrum in a restaurant.
Right.
Listen, I just want him not to hit his sibling.
Yeah.
So they're asking for things that are the most significant in their life at that moment, which, if you remember, Shannon, that was not our goal. Our
Right.
goal was everything that
Yeah.
he needs to learn in order to be part of society in a very happy, comfortable way.
Yes.
So it was a massive number of things. We had a huge bucket full of things
Yeah.
to teach. We don't anymore.
Which kills me. You
Right.
know, I'm in the category of, whenever I get an opportunity to speak to BCBAs, I have a slide that I have that says who voted intensity off the island.
Right.
Because I don't understand that.
Right.
If a group of people say that they are clinicians and scientists and they're following the research and they're following the science, who voted intensity off the island?
And I don't think it was a sudden thing. Like, it was a gradual thing
Yeah.
because of all these issues. Why should there be any intensity if the individuals themselves don't really want to change all that much?
Yeah. Well, I feel like there was a lot of influence by insurance
Oh.
companies, but I find that when I'm in discussions at the lunch or whatever, and talking to these clinicians, and they go, well, you know, that whole concept of recovery, and they'll poo-poo it, and this is why it was important to me to take my son out a little bit.
Right.
Because people say to me all the time, well, if this is true, if there's all these recovered individuals, where are they? To which my answer always is, you know what, they're out leading their lives.
Yeah.
Are you asking them to stop their life and come and
Right.
convince you?
Right.
Like, you know, let's think about that for a minute. They don't
Right.
have time to sit down and,
Right.
but I see the power of, you know, and we try to feature people on the show of all different areas on the spectrum, including those
Yes.
who consider themselves to no longer qualify for a diagnosis,
Right.
right? That did at one point. But you know, you get people poo-poo and they go, well, they probably didn't have it. Oh my gosh. When people meet my son and they say, yeah, I don't think he ever really truly, you had somebody
Had a
who,
diagnosis.
so
Right.
you had somebody
Right.
who didn't know what they were doing
That's
diagnosed.
that was one of the primary criticisms of the LOVA study as well, was
Yeah.
that they probably must have not have a diagnosis. And then the second one is, I can still see some stuff.
Right.
Which is totally fine, because we're not saying there isn't some stuff.
They're
We're
a
saying
person.
it's just not enough. Yes.
Yeah.
Yes.
The Pettit fam said, they said, been lurking but listening, but now they say, I like your points. Esther says, have you heard anything about stem cell therapy for autism? Is it safe, helpful? And I have shied away from it,
Oh,
from
I
talking
did a whole
about it.
show about it on, what was that? Doctor's Show.
About
A
stem
few
cell?
years ago.
Okay,
Yeah,
I'll
yeah,
have
you
to check
should
that
look
out.
up. Yeah, it's the Doctor's Show. I did when we were retired. During that phase, yeah.
Okay.
I did a whole show about it, and I think it was like maybe 2021. So I did a lot of research at that time,
Okay.
and it's all on the show.
Check
so
out the
please
doctors.
look it up. Yeah.
There we go.
It has become like one of the primary things on stem cell clinics in Panama,
Really?
Costa Rica, Mexico. It's like a very big, the first, when you log in, it's autism. And there are some people who say it really changed things for their child. But I think and then there was one study that was published, and I critiqued that study. So I don't think there's been enough research, is the summary.
Okay. All right. Somehow, amazingly, we're out of time, and I didn't get to a single question, and we had questions. Maybe we can revisit this?
Yeah,
or
would love
we'll
to.
See.
Yeah, and you know, it would be kind of interesting also to get a couple of other, either we could take it two directions. One is like, you know, senior clinicians who've also been on this journey for 25, 30 years. and have that discussion as a group. And the other is, I would love to have some talks with individuals who used to qualify who no longer do.
And I think that's really the ticket.
Yeah.
You know, we'll see if anybody's got the time, because they're leading their lives,
Yeah.
which is the crazy, wonderful, perfect
It's
thing.
amazing.
So amazing. All right. Just wanted to say we've got a great show tomorrow. We're having the folks from Autism and Entertainment back
Oh, great.
tomorrow, because they've got
Oh,
a bunch
nice.
of really fun conference stuffs, panels coming up about working, because
Wonderful.
you know, the ability to be able to work,
Oh,
It's
this
everything,
is exactly. See,
right?
This is
You
what
want to
I'm
be
saying.
able to work. So we're talking about that with them tomorrow.
Perfect.
So thank you so much for being
Such
here.
a pleasure. Thank you for listening to me for an hour
Oh my
straight.
gosh, are you kidding me? You always expand my mind. All right, you guys, don't forget, find those. Have you had a chance to find where the All Ghouls tickets are? I didn't either. We were busy. I'll make sure that we have it for you guys tomorrow. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now. Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.